Plasma cell myeloma, previously referred to as multiple myeloma, is cancer affecting the plasma cells in the bone marrow. So these abnormal plasma cells occur in increased numbers and produce abnormal non-functional immunoglobulins, leading to impaired ability to fight infections in the patients affected, and also hyperviscosity and renal failure. In the bone marrow, the increased plasma cells result in a reduction in normal blood cell production and erosion of bone, with resultant peripheral blood cytopenias, osteolytic lesions, pathological fractures, and hypercalcemia. The disease is commonest in the sixth decade and rare below the age of 40 years. Causes are potential precipitants, which are chemicals, for example, dioxins, formaldehyde, nitrobenzene, found in solvents and cleaning agents, ionizing radiation, viruses, for example, herpes virus, AIDS, Epstein-Barr virus, also HIV, hepatitis virus, and also the main cause is unknown. Symptoms include bone pain, easy fatigability, excessive weakness, recurrent infections, and bone swellings. Signs that are usually elicited are pallor, fever, dehydration, bony lumps, paraplegia, paresis, and also renal impairment and unprovoked fractures. Investigations are FBC and blood film comment, ESR as a erythrocyte sedimentation rate, blood urea, electrolytes, creatinine, also plasma calcium levels, serum uric acid, bone marrow aspirates, skeletal survey including skull X-ray, and serum protein levels, serum protein electrophoresis, urine Burns-Jones proteins. Also, the treatment objectives are to reduce the number of abnormal plasma cells to normal and reduce their rate of increase, to treat anemia, reduce bone pain, manage pathological fracture, improve or maintain good bone mineral density, to treat infections, to prevent and treat renal complications. Non-pharmacological treatment: patients should drink at least 3 liters of fluid each day throughout the course of their disease, and physiotherapy, orthopedic supports are required. For pharmacological treatment, to reduce the number of plasma cells and increase of rate, is available at specialized centers only. Also, to reduce bone pain, so you give pain relief but avoid NSAIDs as non-steroidal anti-inflammatory drugs. Also, treat anemia, packed red cells transfusion and platelet transfusion when indicated. Also, to prevent and treat renal complications, IV and oral fluids. So to mitigate tumor lysis, as allopurinol to mitigate the tumor lysis, and also to treat infections. Okay, so referral criteria: all patients suspected to have plasma cell myeloma should be referred to a hematologist at a specialized tertiary center for further evaluation and definitive management. Subsequent follow-up can be done by a physician specialist with guidance from the hematologist.